Assalamu alaikum. This is Sayyida Mahvis Zahra Rizvi here. My roll number is BP1650228. I am morning student, final year. The drug assigned to me is Ivermectin. Its brand name is also known as Stromactal and it's available in this form that is shown. Ivermectin is basically a medication that is used to treat many types of parasitic infestations. In humans, it includes head lice and scabies. In veterinary medicine, it is used to prevent and treat the heartworms and scariasis. Scariasis is basically the infection of the small intestine, and a species that is involved in it is called the roundworms. Its route of administration, it can be taken by mouth or applied to the skin for the external infestations. Adverse effects are fever, itching, skin rash, red eyes, dry skin, neurotoxicity, and ataxia. Ataxia might be a new term for many of the students, so here I am given the meaning of it. It's basically a degenerative disease of the nervous system. Its symptoms mimic that of being drunk, slurred speech, incoordination, etc. Different dosing, it's available in the tablet forms, in solution forms, not in solution, in lotion forms. So tablet available is 3 milligram for different conditions that include strong gyloidiasis of the intestinal tract, in which the dose is 15 kg, 3 milligram per oral, or greater than 80 kg, that is 200 microgram per kg per oral once. In case of the condition that is scabies, that is 200 microgram per kg as single dose. May repeat in 14 days if necessary. Its rational and irrational use. Rational uses, ivermectin is thought to be a host-directed agent. It has broad spectrum activity in vitro against many of the viruses that includes dengue, Zika, HIV, and yellow fever. Antiviral efficacy in vitro would require the administration of doses up to increased amount, like 100 folds higher than those approved for the use in humans. Irrational use of any drug, whether it's ivermectin, it's any of the drug is prohibited and is unethical because it can lead to many different problems like skin problem. Skin problem might be related to allergic problem or inflammatory. It could be eye problem, seizures, coma, low blood pressure, etc. Irrational prescribing and use is unethical, as I have mentioned before, and has greatly reduced the standard of a drug therapy, leading to widespread health hazards. Now we can also use certain types of alternatives in place of ivermectin if ivermectin is unsuitable or due to many socio-economical issues can be there that stops one from using it. So alternatives are metrogel, metronidazole, also called as metronidazole, panacetia, azelaic acid, claris, sulfa-acetamide sodium, doxycycline, vibramycin. The reasons behind the use is that they are basically metrogel, for example, is effective for the skin condition. It has fewer side effects than the oral tablets, and that is low in price, that one can easily afford it. Phoenicia is concerned, so treats raised spots and pimples, low cost and available in both gel and foam formulation. Vibramycin, which is available as liquid solution, alternative to those allergic to penicillin, available at the lowest cost and safe for those patients who are senior in citizens or senior in their ages like 65 or above. So they were basically the alternatives that are more, affordable to patients. Drug-drug interactions. Some of the products that may interact with ivermectin include barbiturates, benzodiazepines, sodium oxybate, valproic acid. That means one should not take ivermectin with these drugs. Toxicity, it depends upon the exposure and the age of the patient. That includes lethargy, bradycardia, ataxia, hypersalivation, vomiting, muscular tremors, mydriasis. Mydriasis, I have already mentioned that it's basically the dilation of the eye. Antidote, there is no antidote for ivermectin poisoning. Most of the patients recover in 7 to 10 days, but recovery of the comatose patient usually needs a longer period. Like comatose patients, the ones who are in coma. Ivermectin tablets are available in 6 milligram. The brands which are available in the Pakistan with their retail prices are as follows: Falvot, which is 265 rupees, Ivermite, which is 100 rupees, and Iverterm, 150 rupees. So one which is the lowest price can be used as an alternative, depends upon the one affordability, depends upon the economic socio-economic status of one patient. According to it, different prices are mentioned and one can use it accordingly. Here is a case study. A family had returned from holiday. 4 weeks later, a 4-year-old girl experiences a pruritic rash along with the burrow. What is burrow? Burrow is basically the track-like or tunnel-shaped rash-like substances, or this is basically a hallmark of scabies. Further, and excoriations in the interdigital areas. What are excoriation? Excoriation is the recurrent picking of the one's skin, resulting in the skin lesion. स्किन खराब हो जाती है या मतलब स्किन को नोच लेना जैसे, तो स्किन खराब, that is known as excoriation in the interdigital areas of both hands. Her mother was suspicious of a diagnosis of scabies. The lesions are scrapped and microscopic examination reveals mites and ovas of the Sarcoptes scabies. How should a girl be treated? Though she uses lindane, crotamidone, and permethrin, but except for the few, no effective results were observed. So what special instructions and precautions should accompany the therapy? That means she was undergoing certain situations which was taken into the consideration. Though she was using different creams and lotion, different ointments, but still there was no effect, no positive response was her body was giving it. Like scabies was untreated. So basically, what additional things we should include in the therapy? Let's see. Scabies with pruritic rash and burrow. This is a basically example I have shown here with the help of a picture so that the idea must be more clear what type of rash or burrow are present on the skin. Subject: gender female, age is 4-year-old. The chief complaint is pruritic rash along with burrow. Scoriations in the interdigital areas of both hands are present. The agents that she was already using was lindane 1%, Kewell, crotamidone 10%, Urex, and permethrin 5% cream, elimide. Object: microscopic examination reveals mites and ova of Sarcoptes scabies. At this point, we come across the idea or a little diagnosis that yes, scabies is basically present. That means her mother was thinking the right way. Assessment: the medications used for the treatment of scabies, their safety remains a point of contention. As I have already mentioned, that she was already using the creams, different creams she was using, but they were not giving any response. That she was not getting full cure from it. So, so there was a point of contention in using such creams. You cannot use them for so long when it produces no results. For example, when lindane is left on the skin for too long, might result in the neurotoxicity. So this was a little bit kind of dangerous point. So we have certain plans for her. Permethrin 5% cream can be used along with the ivermectin. That is basically our chief drug as well. It should be used along with this permethrin stomactol that I have already shown you the picture of it. 200 microgram per kg separated by 1 to 2 weeks can be added to the topical therapy. She should trim her nails to minimize the further excoriations. She should take baths using soft washcloths to remove the loose crust. Her cloths and linens should be freshly laundered, like they should be freshly washed with the hot cycles of temperature greater than 50 degrees Celsius, and she should be re-examined after a week. She should be informed that pruritus can persist for more than 10 years. So these were certain plans that can be applied in addition to using her cream and ivermectin. So here we come to an end. These are some of the references, case study from where I have taken it, book, article, website I have taken. I have utilized all the things. So thank you so much.